Hey Facebook, it's your friendly Knowsy Neighbors, Jessica Garden and
Elise Pell
with the Murdock Manwaring group. So we are so excited today to talk about, because I think there's something you've been seeing and you're wondering what it is.
That's right.
So, we get nosy and we come in and ask some questions. Also, thanks for joining us today. Make sure to like and follow our page if you enjoy finding out about local businesses here in Southeast Idaho, and you'll get more information on that. Also, if you're interested in local real estate stuff, head over to the Murdock Manwaring Company Facebook page and you'll find about all things real estate.
That's right.
All right.
Today, we are here on the corner of Sunnyside Road and Rollandet.
Mm-hmm.
Have you seen this building going up?
This building is going up. It's beautiful. It's modern. It looks awesome. You're probably like, there's no sign.
Right.
What is that building? Well, we know now.
That's right.
We're going to talk to a couple of ladies that are going to tell us a little bit more about what's going on in this building. Okay, let's flip it around this way. Let's just do a little scan here. Oh, fancy meeting you ladies here.
Hi.
Hey. Okay, so what's going on in this building? Because that's a pretty neat little logo. What's happening?
I'm pretty sure you'd like to know. So my name is Stephanie and this is Leslie and we're with Idaho Fertility Center.
Yay! So you guys are already here in Idaho Falls. You're moving to a new location.
Absolutely. Yeah, we've been here at the medical office building next to ERMAC for about 4 years. And we've just gotten bigger and need more space. So we're migrating down Sunnyside to this location.
That's fantastic. All right, talk to us about what, I'm gonna get Elise in here too. I'm gonna go this way. Talk to us about what the Idaho here, Elise, step this side. That way I can get the cute logo in. It's all about this. What is the Idaho Fertility Clinic? What do you guys offer?
Yeah, so we offer comprehensive fertility treatment for any couple who is seeking fertility treatment or have been struggling. So it's just comprehensive care we have two providers, Dr. Parker and Dr. Conley, and I'm a PA here at the office. And so, yeah, we see couples who are struggling or wanting to grow their family.
Very cool. So when we talk about who, so you guys are not an OBGYN?
No, we're not.
No, okay. So if they've gone to another doctor, this is just for fertility.
Yes. Yep. Our doctors actually have the title of reproductive endocrinologist. Yeah, so that's their fancy term.
That is very fancy.
For everybody who doesn't know that, it's basically just comprehensive fertility treatment.
So what kind of people what kind of clients do you see? Is it just couples? Do they have to have tried for who is the clientele of you guys' office?
Yeah, so we actually don't require a referral from your primary care provider. If you feel like you've just done enough treatment with your OBGYN and you're like frustrated, we're happy to see you. If you haven't really done much treatment and you want to hurry and get on the ball, we're happy to see you. So I think, that sets us apart too from other places is we don't require referral. You can just call us when you're to that point that you want to get moving and we'll set you up an appointment.
So what's that point that we get to where we're ready for some additional care?
That's a real
So I feel like
question.
if couples have been trying at least for a year and they haven't been successful, I think that's a good time to come in. Or, maybe they've been doing treatment with their OBGYN and done maybe 3 intrauterine insemination cycles and still aren't pregnant. That's a good time to come in. Obviously, we're not going to refuse to see you. So if you haven't made that time frame or haven't tried previous treatment with your OBGYN, we're still happy to see you before then.
Would someone come here first if they're maybe older?
Absolutely.
And maybe they don't even know?
Yeah.
Could they even start here, or should they start with a general physician or OBGYN?
I feel like once you get to that point in your life where you're just a little bit older and you haven't quite, been successful having kids, or maybe you haven't wanted to try, but now's a good time. I feel like when you're a little bit older, definitely in the late 30s and 40s is a good time to skip the OBGYN and just come to us so we can kind of expedite treatment.
Excellent. So how many different kinds of families are you guys looking at? If you're looking at couples who might want to do this, is it just couples?
Yeah, well, this I think really sets us apart from other fertility clinics in the area is that we will not discriminate. So we see couples who are married, couples who are not married, same-sex couples, single ladies, single men, gestational carriers. We do all of that.
Well, I didn't think about that. I mean, you might be using a surrogate, or you might be, that's really interesting. That's a really interesting thing.
Yeah.
So what about, this is something I think about, it's not fertility, but what if you are wanting to plan, do you guys harvest? If someone wants to have a child later,
Down the road.
I don't know what the term is for it. I think of harvesting eggs, or harvesting stuff. Yeah, obviously I have no idea. Yeah.
Yeah, so we call it, like Leslie said, fertility preservation.
Oh, that is a lovely way to say it. Yes.
So there's like a single lady who just hasn't found the right person yet, but wants to, preserve her egg quality at the age she is currently. We put them basically through a cycle. And instead of, fertilizing eggs with sperm, we just take those eggs, freeze them, and then they're going to be frozen forever, as long as she wants, at the age that she got them, retrieved at.
Oh my word! So I didn't think about that.
Yeah.
So the eggs don't age, because I've heard that a lot too. Is that you as you get older, you might be your baby may be subject to health issues because you have older, and so that solves that.
Yeah.
Oh
So
my,
generally about
I just assumed that solves that, but
it's a way to, curb that. So like normally over 35, your chance of getting some, genetic abnormalities can go up, and even, the older you get. So let's say a woman's, 26, 27, and hasn't found that right person. We'll put her through a cycle, freeze her eggs. Maybe she finds the right person at age 35, and at that point she can have those eggs fertilized and implanted back into her. And those eggs were still as good as they were when she was 26.
holy moly.
So it's a way to kind of curb,
That is really neat.
your chance of not getting a genetically abnormal.
That's right.
Wow.
Yeah.
Another thing that we do with that too is we see a lot of patients that are going through cancer treatment. So before, a lot of medications that you can use with cancer, or even some like for autoimmune diseases, they can affect your fertility for in the future. And so people will go through to preserve before their treatment,
I never even
both
thought
male
of
and
that.
female.
Wow.
Yeah.
So that is okay. That's my next question. So we know you can preserve eggs. Does it work the same way for male?
So,
Or do you not preserve, or it's just they're pretty much good to go all the time?
I mean, they're kind of a little bit more lucky than we are.
Yeah.
But, we do that for like cancer treatments for men. We'll let them come in and give some donations and freeze them. We don't do sperm donations with people who are not our patients, unfortunately. That's a little bit different. That's a little bit different scenario.
Yeah.
But if we have a patient who's going through cancer treatment locally, and the doctor has recommended that they preserve some sperm for, future use, we will see them and freeze it and whatnot. The only thing is sometimes when you thaw the sperm, obviously some of them aren't going to make it, but their fertility is a little bit more preserved than women as they age.
So you guys are not a sperm bank.
We are not a sperm bank for people to come in and just donate and get paid. That is not us. We leave that to the sperm banks like Seattle Sperm Bank, California Cryo Bank, those kind of things.
And just work with them.
So what is the process for a woman that does want to get pregnant? She's had trouble with that. And where would she start with you?
So they first call and they'll get an initial appointment either with me or one of the providers. It just kind of depends scenario what she's had previous treatments and whatnot.
I have an idea. Can we go take a look at what the process if she comes in and tell us the process as we take a look?
So
I'm
first
curious.
she would call and get scheduled for what we call a new patient appointment, and this is our front reception area. It's not quite finished because we're still in the middle of construction, but she would come.
Still darn cute though.
Yeah, she would come check in here, and then we usually don't have a really long wait time just because we're a littler office and whatnot, but we would pull her back this way. So let's go back this way.
Beautiful. Oh, I gotta get this. I gotta get the cool chandelier as we walk back because that is super neat. That just kind of okay.
Okay, come on back, guys.
And they just installed that light right there.
Yes, yeah, we're still in the middle.
It still smells like fresh paint.
Ooh, I love that.
So this is all our hallway that brings you back to where our providers would be. And we have two our initial consult rooms that our doctors and mid-levels would consult in. It's kind of hard to see just because we don't have blinds, but when you consult, you'll sit down with the doctor or the provider for about a half hour, 45 minutes, go over your history, discuss what treatments you've done previously, what testing you've already had done, and come up with a comprehensive plan on what's missing in your workup. And we'll get all that stuff ready to go. And then usually when you come in for an initial appointment, we end up, poking you, torturing you a little bit with a blood draw. We do ultrasounds at all of our initial appointments because we want to see exactly what that anatomy looks like. Yeah, which is all included in the new patient fees and whatnot. And then from there, we either, if you've met with a doctor, they come up with a plan kind of right there, or sometimes you'll have a follow-up after all that workup is back and discuss really what the best option is.
So talk about that cost-wise. I mean, because that is something that you think about a lot with couples that go through infertility.
That's right.
How
Does
much?
insurance help
Oh
with
yeah,
that?
does insurance kind of cover this stuff?
So there's other clinics in Idaho that we know don't accept insurance, but we actually do. So the initial consult is really a workup and a diagnostic appointment. And so we don't really label it as, infertility treatment because it's usually, PCOS or something else that is going on. So we're able to bill it to insurance. Most insurances, and we're trying to, more getting on board with paying for fertility treatment, but most insurances don't cover it, unfortunately. So sometimes when you start into treatment, that's where I think scares people, is that, the expense that comes with that. But our Utah office actually has our financial department, and they're really great about consulting with people, so they're fully aware of what the price is before they start into treatment, and they know the upfront cost and what it would cost.
Oh, that's super helpful. Yeah, awesome. Okay, so we've got treatment rooms. What else have you guys got going on in here?
Okay, so we have this awesome counter and cabinet out here. This is where our medical assistants sit, do phone calls, help the doctors. One thing I'm really excited about, let's go look there. So this is empty right now. You can come in and
I'm gonna come in and go
rotate.
around.
Yeah.
Cute floors.
So this is actually something that no other clinic has as far as private practice. We are going to do HSGs, which are x-rays that check to see if the fallopian tubes are open with dye. Yes.
Interesting.
So cool. So we're going to start doing them. We've been ordering them at, outside clinics, but as part of comprehensive care. We want to keep it here with our patients where they know us and whatnot. So we're going to start doing that and possibly offer it for other clinics for just general OBGYNs to come here, and we'll do it for other patients.
That is neat.
Yeah, so it's going to be really cool.
Yeah, that is really neat. Awesome. And then you said also you have to get labs. Will you guys have a lab here as well?
Yeah, let's look at that.
Oh,
look at that.
yes.
I want to put a disclaimer in there.
Okay.
The lab work isn't included with the new patient consult. Ultrasound is, but lab work gets billed out separately, which we try to submit to insurance.
Oh, there we go.
Sure that's clear.
Oh, that's a good thing to think about.
Yeah, so back here is going to be kind of our employee access. So back here is where our lab is. And while we're not going to be a full lab as far as going to the hospital and getting labs drawn, it's going to be labs for what cater to our patients' needs. And so this is going to be the lab. It's going to be set up with a big machine and the ability, to run estrogen, progesterone, the main hormones that we usually see, and run for our patients. So this will be a lab. Yeah, it's really cool.
Does that help you guys in speed, or is it just convenience?
Yes. Both.
Yeah.
Both a little bit, yeah. So, I mean, it's going to be awesome, to be able to have our patients come in. We do all the ultrasounds. They get their lab work done here.
Yeah.
We get the results here and be able to offer that. Sometimes when you have extra entities out there that are running and helping you get results, it doesn't streamline it as nice as we'd like for a patient. So it's going to be awesome.
So in this, if you're taking a look, how long, what's the process time that you would find out what problems might be? If you're like, okay, I haven't been able to get pregnant, how long does it generally take before you kind of may know what the problems are, or if there is any problems?
So, I mean, our hope is obviously when people come in for a new patient to give them some answers, and sometimes we're able to, but sometimes it takes, the results from the diagnostic testing. And so sometimes that can take 3 to 4 weeks to get everything back to come up with a plan. So our hope would be, 4 to 6 weeks. Unfortunately, sometimes even getting all that information, we still have some couples with unexplained fertility. As you know, sometimes it's a work in progress. You try this, that didn't work. You try this, that didn't work. And so, we try to do the best we can to get these, couples and families to grow and babies.
Yeah.
So,
what is the effectiveness of infertility treatment?
Oh, yeah.
what do you mean?
What is the success rate?
Yeah. If someone comes in, how often do they find that they can have a baby?
What the problem is, and
I mean, our hope is that most people can get pregnant with what we call timed intercourse or intrauterine inseminations, and those are very minimal, invasive. We just kind of guide them through cycles here. We specifically time when they ovulate with what we call a trigger shot, so it helps better time. When we instruct these couples, they should be intimate, or when they come in and do these intrauterine inseminations. typically, you know, under 20% is success with that if you're looking at a given month. And that's why most people try over a year, because, you know, by that time, hopefully they're pregnant.
Yeah.
When we're doing IVF, I mean, for our hope is to be...
So IVF is...
So in vitro fertilization, that's when we're putting on like 10 days of meds. They actually go in and do a surgery and retrieve the eggs out of your ovaries.
Okay.
Yeah, so that one's a little bit more invasive, a little bit more cost, but we can jump up the success to about 60-65% would be our hope. Wow. I wish it was 100%.
Yeah.
It's just not.
It's not always.
We don't have all the answers sometimes.
Very cool. Very cool. Anything else that you guys offer that maybe no one knows that you guys do?
So the HSG, so the dye test for the fallopian tubes is going to be a new thing that we're going to offer. Hopefully by April, May, we're going to start doing those. Okay. The other thing is we're going to start doing semen analysis. So yeah, we're going to have our own
the other
lab
magic
tech
in the lab.
Yeah, we're going to have our own lab girl who's going to come and run our lab, and she's going to be doing semen analysis and actually physically looking at the semen sample and then offering what we call a Kruger that goes with that semen analysis. And that's just a little more detailed information on the morphology and what sperm are normal looking. So that's gonna be really cool. And that will be available too at some point for outside clinics. If an OBGYN wants a semen analysis, we'll be able to offer that. And a little bit more detail to that semen analysis than other places offer local.
Very cool. Very cool. All right, let's walk this way, and I'll come this way. Well, do you have any more to show us back here? This way?
Yeah, just back here.
Oh, let's go.
This might be locked, but this is going to be where we grow. Oh, come in. This at some point will be where we grow the embryos.
Oh, yeah, because that's part of the whole project, right?
It's the first babysitters, the first date
the little nursery.
The little nursery will be in here at some point.
Very cool.
And then right behind you will be converted into our surgical suite. We'll have anesthesia and surgical tables and whatnot, and this is where it actually happens. And this room and that room connect with a window. So this window here. And so when we're doing surgery and retrieving the eggs, they get immediately passed right into our clean lab.
Do they have general anesthesia for this treatment?
So we don't do general. It's kind of like a minimal anesthesia. So patients are put to sleep. You know, they don't feel anything, but they're not intubated. So they're completely breathing on their own and whatnot. And yeah, we have an anesthesia group that comes and does our anesthesia for us. So it really is just total treatment here in our office.
That's very cool.
Yeah.
Okay, so as we walk back, we'll get to see it again. Okay. Tell us when everything opens. Tell us, actually, where are you guys right now? If they're not, can't wait till you guys are here, where do they find you?
Hopefully they'll wait, because it's really going to be next week.
Yeah.
So we are really hoping we're going to start seeing patients March 5th in this new space.
Wow, that's exciting.
It's going to be a little bit of chaos over the next few days, but March 5th, new patients, any patient in this new space, and from then on out.
That's awesome. How do they get a hold if they want questions? What's the best to get a hold of you guys?
Yeah, so we have a phone number at 208-529-2019. They can call us and we'll be happy to set them up with an appointment. We also have a website, idahofertility.com is our website that they can go and check out if they just have some general questions before they call, if they want to get a little bit of information, what we're about, and whatnot.
Perfect. And then you guys also are Facebook page and Instagram.
Yes.
And are you going to have a big grand opening so people can come in and see the building?
We hope so. It's just not quite planned right now. We were hoping till the weather gets a little bit better. So hopefully in the next couple months. So hopefully stay tuned to our Facebook page and we'll give you a little bit more information as we get closer.
Yeah, because this is fun.
Yeah.
Now, I noticed you guys don't take up the whole building. So let's walk back this way. You're not taking up the whole building. So is there still space available in your beautiful building?
Yes. So there's going to be 2 suites that are going to be available for rent. I don't quite know the details of that, but I think there is a realtor that if they want more information, they can...
I know a realtor. Oh, that's right. I believe they're called Murdock Manwaring Company.
Yes,
just FYI.
yes.
Okay, yeah.
Okay,
probably help you.
this way.
I love the doors. I love the look. It's beautiful.
Yes, a lot of details went into it. So, I mean, I don't know what you guys care, but just a little more fancier bathroom.
Ooh, I love those floors.
That is gorgeous.
I love those floors.
Beautiful tile.
And then over here is where we're going to do our blood draws.
This is the part I don't like. I'm pretty tough, but for some reason, me and needles, I don't know what it is.
You don't match?
Yeah. I cry for no reason whatsoever.
We know this isn't a place that you want to be, so we want to make it at least cozy and more
Oh, it's beautiful, and I
inviting.
love the kind of the theme, the light blues and the brown. It's really pretty, really pretty.
And then this will just be kind of like a simple ultrasound room where we do ultrasounds. The majority of our patients get an ultrasound when they come in. So, and then this will go back to the front. But yeah, it's going to be super exciting and comprehensive care. And one other thing is that we do offer genetic testing on embryos. So, the couple that comes in and maybe somebody's a carrier for cystic fibrosis, and they have a child already affected by that, and they don't want to risk getting another child with that. They can go through IVF and check embryos for, genetic stuff that way.
Wow.
Or even just make sure the embryos are chromosomally balanced.
Wow.
So rule out things like Down syndrome and those kind of things. So that's another kind of cool thing if couples are, really struggling, they want more kids, but they don't want to risk, getting something abnormal. Not that you don't love them, but
But if they can if you can minimize that risk.
Or a chance for a different gender.
Gender selection couples who want to, they have like 5 girls and they have a farm that they want to pass on to a boy. That too, they'll come in and want a boy.
Very cool. I never thought about that.
Yeah.
So the whole treatment process can be done right here in your office from start to finish. Okay.
Yes.
Wow.
I love
Very
that.
cool. That's nice and that's comfortable.
Yep.
Especially this is a high stress type of situation.
Yep. And then actually once they get pregnant, we don't kick them out the door quite yet. We'll keep them and see them through about 9 weeks of pregnancy through the end of that first trimester. Once we're sure that everything's good and there's not going to be a miscarriage or anything like that, then we'll graduate them to their OB. So, yeah.
Very cool.
We don't want to take over total care of pregnant people. We want to send them back to their OB. A lot of times miscarriage can happen in those first early weeks, and we still monitor them through that. So.
Yeah. Well, that's awesome. You guys, fantastic. Tell us your phone number one more time.
Yes, Idaho Fertility, 208-529-2019. We'd love to see you if you're struggling.
I love it. Okay, you guys, let's go this way. All right. You guys, this is such a neat place. So again, it's on the corner of Rollandet and Sunnyside. It's a beautiful new building. So come and check it out and follow their Facebook page. And if you're struggling, give them a call.
Idaho Fertility Clinic.
That's perfect. All right. Well, this has been your Nosy Neighbors, keeping you in the know.